Here in the clinic, skin, face, scalp, body. So I address all of that with very similar devices, very similar topicals, and very similar light therapy as well. So 50% is still the injectables, because we know that hyaluronic acid fillers work really well, and they've been working well for years. We get consistent, reproducible, predictable results, and patients love the results.
But there's still a place for them, isn't there? Despite there being so many advances in technology and treatments and all the amazing devices you have here, I think there is still always going to be a place for a hyaluronic acid filler.
100%. I will always start in the temples if there's volume loss, work it down to the cheekbones, just underneath the cheekbones, where we can actually either lift a face or slim a face, depending on how we administer our fillers and in which direction as well, according to the facial
and bring the energy back to the face by restoring the framework that it's supposed to sit in naturally.
Absolutely. And we forget, and we have to remind patients that a lot of the issues with our face are in all 5 layers. Skin, superficial fat, muscle, deep fat, and bone. And we lose a lot of skeletal template as we age. So the way I see it is, you've got to take those 5 layers, which are effectively falling off the bony scaffold. And we have to I almost think of it like face off. And how can we take the face off, those 5 layers, and kind of pull it back up and almost get it to the back of the head and tie a pretty little bow behind it. So I say facial fillers, sure. In those areas.
The structure, just to reinforce.
Absolutely. Laterally first, as well as anterior projection, piriform fossa, jawline, absolutely. But that's going to be a fairly quick fix. We know we can get the job done. But with the inflammation, the aging, the cortisol that's surging from within, not even externally, we know that the skin and the face is getting puffy, waterlogged.
We need to add something else then. Particularly if you're putting the product of the filler in as well. You don't want to compromise like lymphatics.
No, you don't want to do that, because at the end of the day, we also know that with volume deflation, especially in the cheeks, we're not supporting the orbicularis muscle as well anymore. So whilst our patients are wanting facial fillers for tiredness and eye bags and loss of volume just because they are tired and they're losing weight, etc., we should not be going straight in with tear trough fillers, only in my opinion, because I feel that we're not supporting this area. The lymphatics are compromised because of many other reasons. So I always drain my patients, prepare them for a degree of time before I administer my fillers. So always
it's
about
because
the
that
energy.
comes from nearly 10 years of practicing. And I think, it's the beauty in hindsight is be able to look back and say, this is how we used to do things. And actually what we need to be doing now as a result of seeing the results is make these amends. I think draining, stimulating, energizing, and just making sure that whatever product you're injecting is supported sort of by everything else that you're doing.
Correct. So it's a 50-50. So I say to patients, we're going to get there with your facial fillers. So we're going to put that in a corner for a little while. Because I think we need to spend 6, maybe 12 weeks getting your skin health in check. Should they need it, there'll be some patients who we can go straight in. And that's good. So I'll take that segment of patients and park them to the side for this conversation, because some patients can walk in and have their toxin and fillers, no problem at all. I'm talking about the topic that is at everyone's lack of understanding. Where does it fit in? How much is it going to cost? Am I really going to reap the benefits? And that takes a greater degree of conversation, because that's where devices like lymphatic drainage, that's where topical skincare comes in. We have the latest regenerative treatments using exosomes from plants. We have light therapy using Saluma, which we've had for 4 years. And I've recently invested in the full body version, because all about the energy. We want to also upregulate mitochondrial function.
This is a huge sort of subject right now, upregulating the mitochondria, like these batteries of the cells, and really getting the energy back into the body in the most natural way. I think the whole sort of world of aesthetics is very much moving towards this harnessing of the body's own natural resources, the mitochondria, the collagen, the elastin, the hyaluronic acid. We want to basically use what our body naturally has to give us, really supercharge it, power it up, and then reap the rewards. And then obviously sort of sprinkle in the filler and the toxin and everything else. But that's what's so fascinating about what you're doing here. I think, you've really handpicked some brilliant devices and treatments that do all of that. So for that 50% of your patients who aren't ready to go straight into the toxin and the filler, what are the other devices or treatments or facial protocols that they would really benefit from to get them there?
So for me right now, it'll be a combination of drainage, as well as EMFACE. I use that in pretty much almost all my patients.
This is the device behind me.
Every single day now. And because it is my resuspension device, it is my repositioning
It's almost
device.
like the workout for the face, isn't it? I've tried it before, and it's the I mean, you can explain it better than me, but it almost sends, it's that muscle stimulation for all of these very key lifting, elevating muscles to put everything back up into the right place, right?
100%, Francesca. So I use this analogy to my colleagues, like the face falling off the facial template. And everything from the skin, fat, muscle, fat, and bone is all connected together by connective tissue, layers of fascia, as well as ligaments. So if everything's getting looser and slacking in tone, and we know that certain muscles like the zygomaticus, cheek muscle, and the risorius, which holds the face up and wide, if those muscles are losing tone, why not put some energy into those muscles, pull them back again, and by default, they'll pull all the connective tissue and the skin back and
it's like, I mean, it's the same concept as going to the gym for your body, you know, get everything sort of energized and tighter and firmer and stronger, and then hopefully it anatomically is sort of doing what it needs to do and supporting the face. And there's a new applicator for the EMFACE, isn't there?
I'm going to go get it. So I'm going to come off here because I'm excited about this one, you know, because EMFACE we've had here for coming up to 2 years in November. And it's been game changing. When our patients have had the treatment and we've measured it on the Vector 3D with Canfield, it equates to up to 5 cc's of volumetric change.
That's incredible.
Which is 5 cc's of filler, effectively, that I don't need to use now in a patient, where they can have a completely needle-free, knife-free, non-invasive,
natural alternative.
And whilst it's stimulating the muscle using electrical stimulation in a high-intensity focused way, we can also regenerate collagen and elastin because you have radio frequency applied directly to the forehead, directly to the cheeks. And we've been able to stimulate collagen for a long time. We've had radio frequency through Generation 1 devices from 2005 to 10. And they've worked well. But we've never been able to stimulate the other protein in our skin called elastin to quite significant percentages, which is unbelievable. So that device combined with Exion by BTL has just been my treatment blending treatment of the year.
Oh, fun.
And it's fantastic.
To try it at some point. So this is a device that specifically goes now beneath. I was talking about this area earlier. I feel like it needs so much more attention. But it's often the area that we forget about.
I love the
way
way
we're so focused on everything from the chin up.
I'm actually opening the packet because I just want to have it.
You're gonna have to use it now.
No, I will, Francesca. I will. But I mean,
you back on this treatment bed later.
I will do, yes. But I have all these treatments myself because I want these treatments myself to go through as many, well, not as many maybe, but I want to experience everything that
the patient is experiencing.
I am the patient in my clinic. So, you know, I think about my neck, my jawline, you know, my skin's changing, my fat's moving, my muscles are changing in tone, and then my bone is also changing because I'm going to go through the next 5-10 years of my life. And everything else can be addressed non-invasively. We've had devices to treat the submental area, and they've been okay. They've been pretty good. But what else is going to be a little bit more comfortable? Nothing has been able to target muscles under the neck like the digastric ever before. If we wanted to target the digastric, we'd have to refer to plastic surgeons to do deep plane facelifts, liposuction on these areas, whereas this targets the anterior bellies of digastric completely non-invasively.
That's fascinating. So this literally sticks.
It literally sticks.
You're going to use it later.
So it goes under the submental area, stimulates the 2 anterior bellies of digastric, which are effectively skeletal muscles, and they're contracting it supramaximally. So it's pulling everything back up against the floor of the mouth. So we can't hold that position ourselves unless we sucked and held our breath for a long period of time, but it still doesn't grow muscle. We're burning fat. We're tightening the skin, which is all non-invasive. And it's so nice because, again, this is just another example of a device that in combination with, say, toxin, like I regularly sort of have toxin injected into these muscles, the platysma, to try and, again, give that tightness and that shortening almost of the muscles to really pull it all together. Correct. It's really so nice. It's perfect for you. So you've got EMFACE and then the Exion, which we've spoken about, and that's obviously the device where we're talking about upregulating hyaluronic acid in the body, in the skin, which is super interesting as well. Again, going back to the focus on regenerative medicine and where that's taking us. I think any device that we can really see
using and utilizing and stimulating what's going on in our body naturally is fascinating, and you must be seeing incredible results with that.
We'll be coming up to, it's August.
Yeah.
We've just hit a year. So we've hit a year.
Yeah, exactly.
1 year with Exomind. I mean, look, radio frequency has been around for a long time. Generation 1 devices have evolved into 2, 3. They're just all getting better and better.
Yeah.
And we know that, so without a doubt. I think what I love about former radio frequency treatments is, again, non-invasive, with gel, sometimes with needles, microneedling with radio frequency.
Normally quite comfortable, like tolerable as well for the patient, not too scary.
Manageable. And what I've seen is everybody's coming back looking better now than they ever did before, because we've been upregulating the body's own collagen production. We've been doing that well for decades plus. But what I see with Exion, because it's no longer just radio frequency, BTL had patented a targeted ultrasound to go with the radio frequency, where you're not just stimulating heat and warmth, you're also triggering more like a mechanical stress to the skin by vibration.
Yeah.
And that's targeting the deep fibroblast tissue, the cells, to upregulate the body's own HA production. So we've never been able to see that being done in
fascinating.
Any
that's
device.
Coming through a device as well, exactly.
Yeah. So the science of regeneration is also all about an intrinsically hydrated skin, because we know we're getting drier and more compromised because we're losing HA levels every year. So by getting the body to wake up and make its own, cell function and cell behavior is going to be at its optimized as it can be. And when you think of the issue of, or not the issue of longevity medicine, which is all about the long-term health span of us, we got to think we're not lasting till 50 or 60 anymore. There's some patients are lasting till their 90s.
Yeah, exactly.
So we're going to be
time and time again.
We're going to be really depleted by the time we hit our 90s. So I love to say to patients, as part of my 2020 to 24 trends, is try and have these treatments as early as you can.
Yeah.
Don't wait till your 50s and 60s.
When your natural resources are depleted.
The bank is emptier.
Yeah, exactly. Because if you're banking on your bank of collagen or fibroblasts or elastin or whatever it might be, HA, and it's run dry, then sadly there's regenerative medicine is not going to be as powerful as it could otherwise be.
Fertility medicine has always been the case, where everybody knows they need to freeze their eggs, bank things at a much younger age, so that you have more eggs, they're going to be more healthy, etc.
Stem cells, hair follicles,
It's the same thing.
Yeah.
So I love the Exion RF face. I have it myself. We treatment blend it together with this, because that way we treat the frontalis, the cheeks, we treat the submentum area, we remove the pads, and then we cover the patient with gel. Just give them a really beautiful treatment that feels like a hot stone facial massage.
So nice.
And it can treat the lip and the perioral area. So we've never been able to treat lip tissue before.
Yeah.
Non-invasively with devices, safely, comfortably, with no downtime.
Yeah.
And I just love what it's done to even my lips without anything.
God, honestly, where are we going to be in the next 5 years? It's crazy. In the next 10 years, imagine what it will look like.
Well, I think patients are going to be more aware, because they're understanding more now due to social media, to fantastic channels like yours.
Yeah, just conversations, I think, sort of breaking down a lot of the stigma and the taboos sometimes surrounding aesthetic treatments, talking about it, making the conversations more mainstream. I think that's really powerful.
And then finishing off the treatment, you asked me for what my best